One decision inside Medicare can lock you into the wrong doctors, the wrong cause, and coverage gaps you did not know existed. And most people make it without knowing there was a decision at all. And once you make this choice, you do not get a clean reset later. Because everybody calls it Medicare, like as if it's one thing, but it's not. Medicare is 4 separate parts. Each one covers something different. Each one costs something different. And the path you choose during your first enrollment window shapes everything that comes after. And if you're turning 65 or someone you love is, this is a video that lays out the whole system before you choose. Well, here's what you're actually looking at. 2 people turning 65 the same week, same Medicare. One can go anywhere. The other gets denied out of network. This is what we're explaining today. Medicare has 4 parts, 4 letters. Each one does completely different job. Part A is hospital insurance. You get admitted to a hospital, a skilled nursing facility, or hospice care, and Part A pays. If you worked and paid Medicare taxes for at least 10 years, you pay 0 premium for Part A. Now, 99% roughly of the people on Medicare pay nothing for this part. But free does not mean no cost. If you are admitted to a hospital, let's say 2026, the Part A deductible is about $1,736. That is what you owe before Part A starts covering anything. One hospital stay, $1,736 on day 1. And if you stay longer than 60 days, it gets worse. Days 61 through 90 cost you $434 a day out of pocket. Now, after day 90, you start burning through lifetime reserve days at $868 a day. Those days do not come back. Part A covers the big events. But the big events come with big numbers attached. Part B is medical insurance. Doctor visits, outpatient procedures, lab work, preventative screenings like mammograms and colonoscopies, wheelchairs, walkers, hospital beds, the things that keep you out of the hospital. So Part B is not free. In 2026, the standard Part B premium is $202.90 a month. That comes straight out of your Social Security check every month. For the rest of your life on Medicare, $202.90 a month. So that's your number for this video. Write it down. Part B also has a deductible. It's around $283 a year. After you meet that, you pay 20% of most covered services. And here's the part that surprises people. There is no maximum out-of-pocket limit on the original Medicare. That's not a typo. If you have a bad year with a surgery, 3 specialists, and 6 months of physical therapy, there is no ceiling on what you owe. You pay 20% of every bill until the bills stop. It's like a credit card with no spending limit, except you did not ask for it and you cannot close the account. Now, if you already picked original Medicare, that's what you're living with. If you have not picked it yet, this is the part that should keep you reading. Part D is prescription drug coverage. Brand name drugs, generic drugs, vaccines. Part D is not run by the government. It is run by private insurance companies approved by Medicare. You pick a plan. That plan has a list of drugs it covers, called the formulary, and a list of pharmacies you can use. In 2026, there is a new rule. Your total out-of-pocket spending on Part D drugs cannot exceed $2,100 for the entire year. So once you hit that cap, you pay nothing for covered drugs the rest of the year. That cap is new. It did not exist before 2025. It is a single biggest change to Medicare drug costs in 20 years. Now, here's where it gets interesting. Part C is not really a part of Medicare the way the others are. Part C is Medicare Advantage. It is completely different path through the same system. A different way to receive your Medicare benefits, and the decision between the standard government path and the Part C private path is a single most important choice that you'll make when you enroll. And that choice is coming. But first, you need to understand how these two paths actually compare. When you enroll in Medicare, you do not just sign up. You choose a path, not two versions of the same thing, two fundamentally different systems. Path 1 is Original Medicare, Part A plus Part B, run by the federal government, fee for service. You get care, Medicare pays its share, and you pay yours. The freedom is real. You can see any doctor in the country who accepts Medicare, any hospital, any specialist. No referral needed, no network to check. You go wherever you want. The trade-off is also real. Original Medicare does not cover prescription drugs. You need to add a separate Part D plan for that. It does not cap your out-of-pocket costs. We already covered that. And it does not cover dental, vision, or hearing at all. To fill those gaps, most people on Original Medicare buy a Medigap policy. That's a supplemental plan sold by a private insurance company. It pays some for all of the costs Original Medicare leaves behind. But Medigap is another monthly premium on top of Part B. That's another plan to manage. Path 2 is Medicare Advantage, Part C, run by private insurance companies that are approved and regulated by Medicare. So you're still in the Medicare program. Your Medicare card still works. But instead of government processing your claims, a private company does it. And that company bundles your benefits differently. Most Medicare Advantage plans include prescription drug coverage built in. Most include dental, vision, and hearing. Many have a $0 monthly premium based on your Part B costs. And every Medicare Advantage plan is required to have a maximum out-of-pocket limit. So, which, as we just discussed, Original Medicare does not. So the trade-off? Networks. Most Medicare Advantage plans require you to use doctors and hospitals inside their network. Some plans, like HMOs, require a referral before you can see a specialist. If you go out of network, you may pay significantly more, or the plan may not cover it at all. So let's go through this. Picture two neighbors, the same age, same health, same Medicare card. One choose Original Medicare with a Medigap supplement and a separate Part D drug plan. She could walk into any doctor's office in the country and be seen, but she pays $202.90, roughly $203 a month for Part B, plus her Medigap premium, plus her Part D premium. 3 separate payments every month. The other choose Medicare Advantage HMO. She pays $202.90 a month for Part B and nothing else. Her drugs, her dentist, her eye exams, her hearing tests are all included. But she must stay in network for everything. If her favorite specialist is not in the network, she either switches doctors or pays the full cost herself. Same government program. Completely different daily experience. Neither path is wrong. But you cannot easily switch between them later on. And here's why. If you start with original Medicare during your first enrollment window, you have a guaranteed right to buy a Medicare policy. No health insurance, no health questions, no denial. But if you switch to Medicare Advantage first and then try to come back to original Medicare years later, that Medigap guarantee is gone in most states. The insurance company can ask about your health. They can charge you more. They can deny you entirely. One enrollment window, one decision, and the consequences follow you for years. So this is where most people get blindsided. You choose a path. You thought you were covered. When the bills start arriving for things you assumed were included, original Medicare, Parts A and B, does not cover dental care. Not cleanings, not fillings, not extractions, not dentures. Does not cover routine vision. Not eye exams for glasses, not the glasses, not contact lenses. Does not cover hearing aids, not at all. 67 million Americans are on this program, and 3 of the most basic health needs for people over 65 are not in it. So that is not a gap. It's a design choice from 1965 that nobody has fixed in 60 years. So if you're on original Medicare, you have 3 options for filling those holes. Buy a separate dental, vision, or hearing plan on your own. Pay every bill out of pocket. Or move to a Medicare Advantage plan that bundles those benefits in. And those are just the visible gaps. Original Medicare also does not cover long-term care. So if you need a nursing home beyond 100 days, Medicare stops paying entirely. It does not cover most care outside the United States. It does not cover routine foot care. It does not cover cosmetic procedures. Medicare Advantage plans often cover what original Medicare skips. So in 2026, 98% of Medicare Advantage plans offer dental and hearing benefits. 99% offer vision. Some plans include gym memberships, meal delivery after a hospital stay, even rides to doctor appointments. But every one of those extra benefits is funded by the same system that requires you to stay in their network. Every added benefit comes with a smaller map of providers. Nothing is free. The currency is flexibility, coverage breadth versus provider freedom. That's the real equation. And the right answer depends on 3 things: where you live, which doctors you see, and which drugs you take. Not what a commercial told you, not what your neighbor chose, your zip code, your doctors, your prescriptions. So here's what I want you to walk away with. Medicare is not one thing. It is 4 parts that connect to form 2 very different paths. Part A, hospital insurance. Part B, medical insurance. Around $202.90 a month straight from your Social Security check. Part D, prescription drug coverage. Now it's capped at $2,100 out of pocket for 2026. Part C, Medicare Advantage, the private path that bundles everything but limits your providers. The path you choose during your initial enrollment window shapes your costs, your doctors, and the coverage for years. So nobody's going to sit you down and walk through this. The Medicare card shows up in the mail. It does not come with a decision guide. This series is that guide. Every episode in the Medicare Decoded builds on what you just learned. So the next episode, we go inside Part A, what your hospital benefits look like when you use them, what the deductible means in real dollars on real hospital bills, and the skilled nursing facility trap that catches families every single year. So go to Medicare.gov, plan compare. Type in your zip code. Look at how many Medicare Advantage plans are available where you live and what they cost. Then look at the Medicare plans in your state. Do not enroll anything yet. Just look at it, compare. See the fork in your own eyes. It takes about 5 minutes. This is not a card you got in the mail. It's a path you are choosing. And the window to choose it right does not stay open forever. And that's what we cover next. Are you on the original Medicare or Medicare Advantage? Well, drop it in the comments. I want to know which path you choose and whether you would choose the same way again. So if this is a kind of Medicare content that actually helps you make decisions, subscribe. Every episode in this series builds on the last one. So I'll see you in the next one. I'm Hanh Brown, and this is The Hanh Brown Show.